So, Peggy Franklin, I asked Peggy to come do this talk because, as you guys know, yesterday during my presentation, we talked a little bit about childhood chronic illness, and we wanted to address more about what we can do as parents and future parents to prevent disease in future generations. So not only taking care of yourself now, whether you've had children or going to or are pregnant now, but you can also do things strategically so that your child is healthier when they are born, during the birthing process, and as they are growing up. So let me tell you a little bit more about Peggy. Peggy Franklin is the founder and owner of Nova Natural Birth Center. She was trained and practiced as a registered nurse in a hospital setting, but then chose to become a non-nurse midwife. She wanted a holistic way to help women and babies. Peggy says her heart was aching because of the one-size-fits-all care that she saw too often. Today's maternity providers are too busy to see the mother as a unique person with unique needs. So Peggy became a certified professional midwife to be able to give expectant parents more personalized care. She's assisted with thousands of births over the years, and she now runs her own birthing center with a half dozen midwives under her watch. Please welcome Peggy Franklin.
I have a clicker. Thank you. Well, thank you so much, Robin, for giving me a chance to share my heart with you and to share some tips and things that you can do for yourself or for anybody you know who may be pregnant or planning to be pregnant. Most of us know somebody who will be in the next little bit. It all goes back to being healthy for the mother. But I wanted to just talk a little bit about the history of childbirth in America. Even though it was really bad before, it's still not a whole lot better. We still have one of the highest fetal death rates, and we still have more premature births than almost any of the other first world countries. Anyhow, right now, I'm just going to go ahead and go on, because I could go on and on about the history. So we want to start with a healthy mother, then we'll have a healthy baby. That's our premise. A healthy child, and the healthy child becomes a healthy adult. So we're going to talk about ways to improve your child's health. A lot of it's going to start before you even become pregnant. And then during the pregnancy, each of the three trimesters, the labor, the birth, and then afterwards, breastfeeding. Some of these things are almost all preventable by healthy nutrition. Anemia, mother needs to have more green foods, iron, diabetes, less sugar, hypertension, less stress, preeclampsia, the same, placenta problems. All of these things can be improved or minimized with good nutrition. So it goes all the way back to the very beginning. Our bodies are pretty amazing. If we provide the nutrients it needs, it performs perfectly. But if things are missing, it still does an amazing job, but things aren't going to work quite as well. We start out with atoms and electrons. We have the methyl groups, the carbon, oxygen, nitrogen. Then they become organelles and elements and the enzymes and the hormones. We need all of those things. It's like setting up a row of dominoes. And if we only go so far or we take a few out, we're not going to get the end product that we want. So it's pretty amazing. There's a movie that talks about becoming pregnancy and about fertilization, and it goes through all the anatomy, and the little villi that are in the fallopian tubes are absolutely essential. It's down to the little details. It's the miracle of life. Yeah. So our bodies, we have superpowers. We can build a baby from 2 cells. So we have all these things that come from 2 cells. So healthy mom, placenta, the umbilical cord. You've probably all heard lots of horror stories about the umbilical cord was around the neck or had an emergency because the umbilical cord. Well, just drinking enough water, having enough protein and vitamin C, your umbilical cord is going to be nice, fat, and chunky. You'll see a picture of one later. And the blood vessels to the baby go through the umbilical cord. So anytime those blood vessels get compressed, your baby isn't getting oxygen. So having a nice, chunky, thick cord gives your baby blood vessels a good cushion and prevents that from happening. Of course, I'm prejudiced, but having a physiological labor, a non-induction, is definitely going to be an improvement. Induction, epidurals, cesarean sections disrupt the hormonal patterns, it disrupts the microbiome, it affects so many things. We don't think about it. So many people have it done and apparently are okay, but if you get really down to it, it has a major disruption in the normal function. And the same with physiological third stage. If you let the body do what it's supposed to do, the uterus is going to start contracting and it's going to start pushing the placenta out. The mother nurses the baby and more contractions, it comes out. And it prevents the bleeding that way instead of yanking on it and pulling on it and causing more problems. And breastfeeding without supplements in the presence of the mother for 24/7 the first year is really essential. It's amazing. If you can at all, do it. That's going to be a big benefit to your baby's health. So I'm just going to talk about the things you can do before you get pregnant in each trimester, and then some afterwards. So preconception, if you're ever thinking about getting pregnant, you want to think about it ahead of time. And that way you have time to get ready. We're going to talk about testing, doing a cleanse, how to hydrate and nourish your body, managing stress, and things that you should learn before you get pregnant. So it's important that you know where you're starting from. Do you have any deficiencies in any vitamins? Any health issues, any genetic issues? Some of the things that you should have done is a complete physical exam, including the pelvic, and be sure and note the breast for any flat or inverted nipples. A thorough dental exam if you are harboring any cavities, any cavitations under the teeth and in the bone and the nerve area. Those are anaerobic bacteria most of the time, and those are the bad guys. And they end up getting really close to your heart through the circulation because of their location and where those germs and toxins are absorbed. So get a complete blood chemistry, liver function panel. It's good to know where you're starting at. Liver function is essential for minimizing preeclampsia, which is one of the major diseases in pregnancy. Thyroid. And I put down there the Zika thing, and I just wanted to say how I'm so frustrated because Zika is another one of those thingies. Is it real? Is it not real? And I've heard they put this medication in the water down there that interrupts the mosquitoes' fertility. And I'm thinking, what? This is in the drinking water. Anyhow, so much for that. Some things that you might have to ask for if you're going in for a preconception exam would be vitamin D levels. We're going to talk a little bit more in depth about vitamin D and MTHFR. Cystic fibrosis, if you and your husband are both carriers, your risks are higher to have a child with cystic fibrosis. Hemoglobin A1C is going to give us information about your risk of being diabetic. And knowing that ahead of time will give you some chances to improve your diet and exercise. Group beta strep is a major infection and can cause death in newborns. If it's in your urine, then it's even more likely that your baby would be exposed to it throughout the pregnancy. So it's really important to get that treated. And of course, bacterial vaginosis, sexually transmitted infections, and GBS would be important to get rid of. So what is MTHFR? Some of you in this audience probably know what it is, but it's an enzyme that we need for the absorption of folic acid. And of course now everything's supplemented with folic acid. So most medical providers don't think that MTHFR is a big deal, but it can be a big deal. And it's common. 1 out of 2 people have polymorphisms or a change in the shape of the enzyme. And it's not able to complete their functions, which would be to form neurotransmitters and SAMe. So this is one of the major things that you can do in pregnancy to minimize your baby's risk of having autism and ADHD. Some of the less common or less serious things would be brain fog and insomnia. Some of the major things would be schizophrenia. And I don't know about you, but I know more than 1 handful of babies and young children who have leukemia now. That never used to be the case. Anyhow, it's possible it's related to this. Can also cause miscarriage, infertility, and thrombosis. So, what to do about this? Make sure that your vitamins are folate, the methylfolate, the quadramethylfolate, and then vitamin B12 as well, because this is the form that your body needs to be useful. Folic acid needs 1 more step before your body's able to use it. And if you have polymorphisms, then you're not going to be able to convert it. So if you have time, you can change any mercury fillings, avoid gluten. But the best thing is to eat greens every day. Eat a raw green every day. So salad, smoothies. There's so many reasons why we all say those things. So if you have time, do a cleanse. Try to remove any of the toxins, parasites, heavy metals. We live in a dirty world. And of course, you probably all know, stop doing nitrate foods, of course, smoking, alcohol, drugs, medications, plastics. And I think more and more of us are becoming aware that there are chemicals in our household products and our personal care products. They're everywhere. And then sunscreen. Stop wearing sunscreen and try to get some sun on your bare skin. So if you do that, be careful of the ingredients in case you do get pregnant. If you are cycling and not protecting yourself, then some of the cleansing ingredients could be a teratogen or affect your baby or cause a miscarriage. Some good cleansing herbs to add to your foods would be cilantro and parsley, dandelion and burdock make good teas. For parasites, you'd probably want to do wormwood and black walnut in the tincture form. Turmeric, milk thistle, ginger, ashwagandha, those are all good tonic herbs. Of course, antioxidants are good anytime. Vitamin C, I strongly encourage everybody before and after you're pregnant to take 1 to 5 grams, 1,000 milligrams of vitamin C. It's best if you take it throughout the day rather than all at once. And then consider enemas, colon cleanses, and vitamin C in large doses and magnesium can create diarrhea, and it's a good way to get a colon cleanse or a flush. One of the doctors, Dr. Levi, who talks a lot about vitamin C benefits in healing, recommends that we all do a flush every now and then. And then the sauna. I'm surprised at how many people still don't realize how bad sugar and hydrogenated fats are. So the simple carbohydrates, even high glycemic fruits can be hard for us. Try to avoid foods that are supplemented with folic acid. Vitamin D2 is not the right form. We need D3. And nobody needs to take a calcium supplement. I'll just say that. Yeah, and unless you've been told you're anemic, I wouldn't take an iron supplement. We'll talk more about supplements in a minute. Of course, nourishing, hydration. Hydration is so important. Get a good source of clean water. You should drink half your body weight in ounces. Try not to get it in plastic. And keeping the toilet white is another good marker that you're drinking enough. Of course, the same message everybody's been sharing today: eat organic, non-GMO, whole foods in their most natural form. And greens, raw leafy greens every day. Steamed is good too. We need all of those. And then some of the superfoods: spirulina, chlorella, chlorophyll, alfalfa, and nettle teas are awesome. So everybody knows you need to take a prenatal vitamin, but why? A lot of them aren't worth it. So you want to find one that's whole food based, not in the synthetic form. One of my frustrations with our science and current medical condition here in America is that we find something that's good for us and we take it out of the real thing and make it separate. So, for instance, the fish oil. Oh boy, we realized how important DHA and EPA are, the essential fatty acids. So now you can get them all by themselves. However, it's still better in its complete real form. Fermented cod liver oil is ideal, and krill oil has fewer mercuries and things like that. One of the things that you might want to know is that the fear of having too much fish because of the mercury is a little bit overblown, and they've come out and made it clear that they're recommending fish 3 times a week is better. I mean, the risk of having fish, the benefits of having fish 3 times a week is better than the risk of the mercury. So there's Perfect Prenatal, Bellamins, Rainbow Light. Those are a few good brands. So the essential fatty acids, these are things that every single cell needs. These are things that our bodies won't produce, so you must have them ingested. And they work together, so just taking a DHA by itself isn't all that helpful. Flax oil is wonderful too, but it works in a different way, and we don't need as much of that type of omega. But it is essential in helping with the cell wall. I like to think of the cell wall as kind of surrounded by guards, and these guards are prostaglandins, and they tell us different things, what to go in and what to stay out, and let things in and out the gate of the cell wall. And that gets more important as we get to labor, so I'll talk about that. So if you're going to do a fish oil, check for purity and freshness. They are really easy to become rancid. What the potency is. If you do the fermented cod liver oil, you're also getting real vitamin A and real vitamin D, the right kind, and vitamin K too. And we're learning more and more about excuse me, about how important vitamin K2 is. And they all work together. So it's the same with herbs and all these different things. They work best when they're in their original whole environment. Another thing that sometimes I think we just kind of blow over, oh yeah, I'm busy, oh yeah, I'm too tired, oh yeah, and we don't really do anything about it. But when your adrenals, when your stress levels are high, your hormones aren't working, that's going to affect so many processes in your body. Some of the things you can do is keep your blood sugar balanced, including protein in your snacks throughout the day, skipping caffeine, getting plenty of sleep. Address the issues, such as work, schedules, money. We've had a few people yesterday talking about how we need to love ourselves and we need to accept the realities that, hey, maybe we do need to change something. And exercise should be fun. I think it was Noelle yesterday who was saying that exercise got so that she wasn't having any fun doing it. And so then we stopped doing it, and it's not really helping. It's creating more stress. So find something you really enjoy. Dancing, yoga, calisthenics. Just turn on the music and move. Learning is going to be important with pregnancy. So many people just kind of, oh yeah, I'm going to have a baby, and then I'll see an OB, and I'll have my baby in the hospital, and get an epidural. And they don't know what there's options. They don't know if there's any benefits or risks to anything else. So start learning. Know what you want and know what is available. One of the things before you get pregnant is you should learn is how to chart your cycle. Fertility awareness. There are several different books, but learning how to chart it, and when you ovulate, learning your signs, all those things are going to help. It's so important to know when your last menstrual period was and if you were cycling regular. If you don't know, then we really need to get an early ultrasound. And early ultrasounds are one of those times where there's the potential for more risk to the baby. Childbirth classes, please do consider them, especially the first time. And hospital classes are pretty much just going to tell you, this is how we do the epidural. So try to find one that is supportive of out-of-hospital birth. During the first trimester, one of the main things is to avoid things that cause risk to the developing baby and providing nutrients. I always want you to think about these tiny cells are so vulnerable during that time. So be a purist. Think about what is it that you do every day? How often do you do it? Because if it's something you do every day, if you do it multiple times a day, it's going to have more effect on this baby. So do avoid medications, vaccines, x-rays, MRI, CT scans, other radioactive things, cellular, Wi-Fi, electromagnetic exposures, and avoid routine ultrasounds. So nourishment in the first trimester is a little tricky because you're feeling pretty bad. You're nausea, you have cravings, you want it now. So it's really easy to reach for the cereal and bagels and things like that. So if you think ahead, you can have some nutrient-dense snacks ready, something that's comforting to you, something you know you will enjoy. One of the things that I enjoyed was rye crisp crackers and cottage cheese, tomato juice. So sometimes it's salty you crave, sometimes sweet. If you're feeling really nauseous, you can skip the prenatal vitamin during the first trimester. Your body can actually do a good job on what you've already done before you got pregnant for those first few weeks. And they tend to make you feel more nauseous, especially if they don't have the methyl form of bees. So constipation is another common thing in the first trimester, and keeping the bowels moving is really helpful. Magnesium is an awesome mineral that we need, and it's also helpful for keeping your bowels moving. During the second trimester, you're going to start to feel better, and that's when you want to pour on the nourishment. So vitamin D, it's essential for so many things. It's in every cell, and it's necessary for calcium absorption and healthy cell function. It's important that you are at the right level. Somewhere between 50 and 80 is the right level. So this is something that you definitely want to have tested before and during and after any supplementation. You can take up to 10,000 IUs a day, but you don't want to continue that amount forever. So it's important that you try to stay in that normal range. All cancers are associated with both low or high vitamin D levels, so that's a really important one. The best source, of course, is the sun. Just try to get 15, 20 minutes as many times as you can. You don't have to be out all day to get the benefit. And if you are going to be out all day and you haven't been out all day, then you do need to use a little bit of sunscreen, but try to have time where you don't need it. So the second trimester is the eat, love, pray, or eat, learn, play. Just enjoy that time. During the third trimester, you can start to prepare for labor and birth, and it's important that you consider GBS. And I also encourage you to do some natural labor stim things for somewhere around the 36-week mark. Preterm and postterm are two of the risky times you want to avoid. So GBS is one of those bacteria that can cause infection in the baby. And it's a common bacteria we all have. It sometimes overgrows, and it's important that you get that checked out. The CDC recommendations now are IV antibiotics in labor, but if you can minimize that with probiotics in your pregnancy, you're going to be way ahead of the game. All those fermented foods over there, take it seriously. It makes a big difference. Yeah, the scary thing is babies are born sick. They come out and, hours later they could be dead. It's encephalitis and pneumonia. So there aren't very many babies born sick, but when they are, it's not good. So probiotics are the good guys. I think we've all talked about that enough here. Natural labor support. If you're interested in more information about that, I'd be happy to talk to you one-on-one. We're running out of time now, so of course, having a natural labor, avoiding the interventions, having the support of midwives and doulas. Vaginal birth is really wonderful, if at all possible. There should be no need for 30% of us to have cesareans. Delayed cord clamping was another thing I really wanted to encourage you to consider for your birth. You have to ask for it in the hospital, and if you can have it, the cord intact until the placenta is born, that's better, but you'll be lucky at the hospital to get a minute or two. There are stem cells in the blood. A third of the baby's blood is left in the placenta when the baby's born, and unless it is allowed to continue with unclamped cord, the baby's missing all that. And studies are showing that babies who had delayed cord clamping of at least a minute to 90 seconds are not anemic all the way up to age 5. So all these recommendations that you supplement your baby with the iron because it's not in the breast milk, if we did it right, we wouldn't need that. Anyhow, look, can you see that cord? How nice and chubby it is? Golden first hour, immediate skin to skin, there's nothing like it. And there's so many changes going on in you and your baby. The hormones are changing, the baby's circulation changes, and if you can be together skin to skin, that's ideal. That's going to set up your baby's microbiome for life. And his brain is imprinting all these smells and sounds. Everything is happening right then. That's going to be there for a lifetime. We call it the golden hour. And breastfeeding, there's nothing better for your child than breastfeeding. Breast milk is actually live. It has live cells, it has stem cells, and nursing your baby up through at least a year. Having support from family and friends, The first 3 days are tough, the first 2 weeks are tough, and the first year is tough. And we will have a better society if we all support our moms during that time and help them have their babies together. Is there time for questions or?
We
Better-
have time for one quick question. And then you're here, though. You have a table in the exhibit hall. So
Yes,
people
I am.
can go chat with you during the lunch break,
Exactly.
right after
Yeah.
Rob talks. Did you have a question?
I was curious, you said no one needs to supplement with calcium. Can you explain why?
Yes, partially because with our diets the way it is, it's going to end up in the wrong place. It's going to go to the arteries and not the bones. It's going to just create problems. Yeah, I can't go into, it's pretty complicated, but yeah.
Well, you told me once that it also, if you do it during pregnancy, it makes the placenta
Crunchy. Yes, it does. Yes.
Okay, but maybe ask her if you guys have questions about that. Let her explain that more fully because it is a complex issue. Okay,
Thank you.
Peggy Franklin, everyone.